I'm very happy to be in St. Petersburg today at the 10th Martens Lecture, which is also an opportunity to think of the 150th anniversary of the Geneva Conventions and also, of course, of 150 years of humanitarian action of the International Committee of the Red Cross. Martens has been, and I would like to say this very clearly, one of the first personalities worldwide who really was a specialist of international humanitarian law, a Russian lawyer who gave his stamp to the international humanitarian law. Fyodor Martens was a very important and also well-known Russian lawyer who worked very often as an arbiter, also in the Hague peace process. He was also a candidate with the Peace Nobel Prize, which is a parallel, as a matter of fact, to Henri Dunant, who was the first winner of the Peace Nobel Prize. I'm very happy to be here, and I had the possibility to speak to the conference about the challenges of humanitarian action today. I had the opportunity to speak to the conference about the challenges the humanitarian work has to fight with in our days, and also tried to explain how the ICRC is facing this new situation and the situation we have got today. So we spoke about the assertiveness of the national states, who very often try to keep humanitarian workers out of their territory. And this brought us to the fact that the possibility to get access to the most vulnerable is probably the biggest challenge we have got. Because to be there where the most vulnerable are, the people in need, is really the most important thing we have to do. It is at the core of our mandate. And we think, and I explained this to the audience, that the principled approach the ICRC is working with, that we are strictly independent, neutral and impartial, and that we are also only doing humanitarian actions, that this is a remedy how we get best access to the ones we would like to help. We also had as another challenge the danger that humanitarian action can get instrumentalized or even gets into political discussions. And there we tried to explain that we have to stick really at our principles, and that we have to try not to get into political reflections. Sometimes states would like humanitarian actors to follow their own goals, to do, for instance, only relief work and no protection, or to help specific parts of their population and not others. And there we have to be very strictly and stick to our principles, because otherwise we will not be consistent and we will lose access on a long term. One topic which was discussed, because it is of a burning actuality, is also that we see more and more deliberate attacks on medical personnel and also on wounded patients. And we see that ambulances get targeted, we see that hospitals are shelled. We have the example of this graduation ceremony 2009 in Somalia, where a suicide bomber killed several doctors and also freshly graduated medics. And we think that it's extremely important to also explain that this is not only an individual tragedy for these people, but that it's also extremely difficult for the whole community, because if you kill in a country where medical personnel is extremely rare, if you kill a doctor, it is like a knock-on effect, and hundreds of thousands of people afterwards will get no treatment. That's why we think it's extremely important to launch this new idea that the ICRC launched in 2012, the project we call Healthcare in Danger. We have to look with all our means and with the help of the national societies, which is extremely important, the Red Cross and Red Crescent societies, and also the medical associations, that we get a better protection for the emblem and for the medical personnel and the patients.